Welcome to all the viewers of Kalinga Literary Festival. मेरा नाम शरत है और आज एक बड़ी ही एंगेजिंग कॉन्वर्सेशन लेके आया हूं मैं आप सभी के लिए. And I say engaging because I have a very unique person today who has created something really unique. इनके बारे में मुझे बस अभी कुछ दिन पहले पता चला, and when I chanced upon his book, it opened a very different universe, a very different world in front of me. तो उत्सुकता बढ़ गई, क्यूरियोसिटी बढ़ गई to know more about this. And उसका नतीजा ये है कि आज डॉक्टर नटवर शर्मा is connecting with us from Kuwait. बहुत बहुत स्वागत डॉक्टर साहब. डॉक्टर साहब, can you hear me? I think थोड़ी connectivity issues है. डॉक्टर साहब, can you hear me? अच्छा, जब तक डॉक्टर साहब आते हैं, let me give a brief background about Dr. Saab. Now, Dr. Natwar Sharma is an associate professor in pediatrics and pediatric critical care in Savita Medical Hospital, Chennai, and currently is on a sabbatical in Kuwait. Acha, right from the beginning, he was an exceptional student. He was awarded the National Gold Medal for Pediatrics in 2006 by the National Board of Examinations. He was a member of the Royal College of Pediatrics and Child Health, UK. He served and trained in the Apollo Hospitals, Chennai. And I think now Dr. Saab is with us. Dr. Saab, can you hear me?
Hi. Sorry, there was a internet disruption, so I'm back.
No problems, Dr. Saab. मैं तो ऑडियंस से आपके बारे में कुछ बता रहा था कि आपने कितने झंडे गाड़े हैं. The phenomenal track record that you've had. I was mentioning about your gold medal in pediatrics. I was mentioning about the fact that you're a member of the Royal College of Pediatrics, Child Health, your stint at Apollo. And then I was just about to tell the audience that while he was practicing, something really interesting happened, जिसने इनकी जिंदगी की दिशा को बदल दिया. तो डॉक्टर साहब, वो क्या था वो इंसिडेंट और कैसे आपकी एक नई जिंदगी शुरू हुई, वो जानेंगे आपसे. लेकिन उससे पहले जितने भी लोग इस ब्रॉडकास्ट को देख रहे हैं, मैं चाह रहा हूं कि डॉक्टर साहब की जो किताब है, जो इस एक्सपीरियंस से बेस्ड है, उसकी एक झलक मैं सबको दिखा दूं. दिस इज द फैंटास्टिक बुक दैट डॉक्टर साहब हैज रिटन. एज यू कैन सी, थोड़ा सा Metaphors of Memory by Dr. Natwar Sharma. That's the book that we are going to talk about. Dr. Saab, welcome to the Kalinga Literary Festival.
Thank you so much for the good words, Sharat.
तो ये सब शुरू कैसे हुआ डॉक्टर साहब? How did this book come about? How did this journey into regression therapy start? इसके बारे में थोड़ा बताइए.
See, everything has a beginning, and my beginning was actually, if you trace it back from childhood. So by nature, I'm very curious. And as a kid, I wanted to become a detective, but my father pushed me to become a doctor. And
मतलब आप basically,
I was disappointed.
मतलब आप basically Sherlock Holmes हो in disguise.
Oh, yeah, I rever him, basically, One obsession I have is that. So,
oh wow.
And when I become a pediatrician and I realized kids don't complain, we need to find out, we need to be sensitive, we need to be open, we need to be very attentive. So, science of deduction.
You have to use the science of
deduction comes into picture. So, and the first instance which actually sort of really influenced me when I was in my first year of my residency in pediatrics. I saw a 4-year-old boy with blood cancer. It's called acute lymphoblastic leukemia.
Okay.
And this boy was emaciated, sick looking, on chemotherapy. And once I went for rounds and I found this boy sitting with another boy who looked much healthier and, bigger and stronger. So I asked him, "Is he your elder brother?" So the mother says, "No, no, no, he's the twin." And then she showed the picture. They both look alike. They are basically identical twins.
Okay.
And when I came out, I was completely, confused, because when you look at identical twins, every cell in their body is same.
Hmm.
The genetic makeup is 100% same. So starting from the origin, from the time of conception, 9 months in the womb, outside the womb, the kind of environment they had, the kind of love, affection, everything you can think of is same. Even the dresses are same. So why one kid gets a blood cancer while the other is fine? So now what's the difference between these two? So then the concept of soul comes in. Okay, the soul was different between these
Hmm.
two children. And now in our Hindu tradition, they say, karma flows. So then I said, okay, maybe this soul had a bad karma and suffering. But then the curiosity built up, and I came up across other anomalies which added on. And my guru Chariji actually said one big statement that really, uh, made me go deeper into it. So he said, "Natwar, remember one thing: the knowledge which you have, you think is, an epitome. But please remember that you should always be wise enough, humble enough to say how much I don't know."
Hmm.
And then the quest began, and starting to read books by Ian Stevenson, and then, other books, Many Life, Many Masters. And I said, let me have a hands-on experience, first-hand experience. Okay, that's how it all began, out of curiosity to
First
basically
hand
find out.
experience of what, Doctor?
Beg your pardon?
First hand experience of what? You said, let me have
Okay.
a first hand
A
experience.
first-hand experience about regression. Okay, do past lives exist? Yes. If
Hmm.
they exist, is there a possibility of recalling a past life? Second thing, and if I recall a past life, is there a possibility of healing by recalling it? So that was
So,
very
so,
strange to me.
so a bit about this entire philosophy of past life regression. Correct me if I'm wrong. The philosophy is that if you are aware of what happened in your past life, you can cure a lot of ailments. Is that what it is?
Yeah. So just knowing is not enough. See, if I go to an astrologer, we have many, they say, "Oh, aap पिछले जन्म में past life में you were this and this." It doesn't help me. It just gives me, okay, this is the thing, but doesn't help me completely.
That's
Then
right.
if you look at Edgar Casey, he was a psychologist, famous psychologist, who would use himself as a medium to tell people's past lives, but it didn't help much. It was just like a diagnosis. I have diagnosed the problem, but treatment to do. I mean, where
बिल्कुल
is the
सही है,
treatment?
सही,
Yeah,
बिल्कुल.
so diagnosis is not enough. We need to treat the problem. So that's when, other people who came in later, Maurice Netherton, he devised specific methods to basically provide treatment. So diagnose the problem and treat it.
I get that. तो फिर आपने क्या इसका कोई कोर्स किया? Did you do a workshop? How
Yeah.
did you learn this?
So I did courses. I started with simple courses on hypnosis. Okay, but then I found those courses were not enough. It is just like giving you a tool. Scalpel pakda diya haath mein. Okay, now kato ab. You cut the abdomen. What do I do after I cut open the abdomen? There is so much inside. I don't know what is going to come out. So basically, it had to be refined. So that's when, I actually gained hands on Tasso International. It's based in the Netherlands. So it actually gave me a lot of insights. I had a lot of curiosities, a lot of questions which were answered.
And then did you put it to use? कोई ऐसा एक्सपीरियंस, ऐसा कोई कोई गेम चेंजिंग या ऐसा एक माइलस्टोन जिसने आपको कॉन्फिडेंस दिया इस थेरेपी पे?
Yes. So I can clearly recall, I have also mentioned in the book, and I've changed the name, of course, Akshara, the patient. So I'm doing the session. Before starting the session, we had a lot of discussion. So this girl, she had a problem called pure red cell aplasia, in which the blood in the body stops forming. So basically, in the bone marrow, we have mother red blood cell, which manufactures daughter red blood cells.
Okay.
Okay, and these red blood cells carry, oxygen, give us life. So what was happening in her condition? The white blood cells were entering the bone marrow, destroying the mother red cells. So there's no manufacturing happening. So she would need blood transfusion very frequently, almost once in 2 weeks, and her hemoglobin would drop to 2 grams per deciliter. So when she comes, I said, Bob, sorry, this is a very serious condition. I can't help you because what I have learned or experiences in the past where this for psychological disorders, emotional disturbance, phobias, depression, fine. But this is a physical disease which is so serious. You're on anti-cancer drugs, you're on immunosuppressant drugs, you're on steroids. I said, I'm sorry, I can't help you. I don't think this is for this problem. But then she insisted. She said, why don't you give one try? I don't expect anything from you. Just give a simple try. So I said, okay, because for me, it was a challenge and plus an opportunity to explore ki, haan, bhai, at least let's find out what could be the reason behind this,
Yes.
if at all there is. So I start the session. She moves back in time in Madhya Pradesh, Middle India, 1910, born to a zamindar family, happy
ये
family,
अपनी
going.
पास्ट लाइफ बता रही हैं, पास्ट लाइफ बता रही हैं.
She's actually telling her past life, narrating her past life.
Okay.
When she's 10-year-old or 11-year-old, she gets married. And by 14, 15, she has a son. So everything is good celebration. Zamindar family mein waris aaya hai. I mean, there is an heir coming in. So things were going fine. Husband is nice, but the husband dies quite young, and she brings up the son. As the son grows up, he turns out to be a crook. He is verbally abusing her, sometimes physically abuses her, and he gets into bad habits. And there's a lot of property, ancestral property, because zamindar. And when he grows young, he tells his mother, please write the property to my name, and this belongs to me. She said, no, I will not write everything on you because you will destroy everything. I will give it to a trust. And that's when the son gets very angry one day. He's drunk and he takes a flower vase, bangs her head. And in that moment, I feel, oh, because she's losing a lot of blood from the head, that is a memory that is making her seek blood transfusion.
Oh.
So, and then I ask her, Kitna khoon baha? How much blood did you lose? And she says, blood loss, nothing. Dead. So I said, no blood loss, nothing, dead. What is this? I mean, past life doesn't make any sense to me. I said, come on, yaar. It is like, so that very low moment, I felt, yaar, we explored, doesn't add anything. And that's when a moment of intuition came in. So this was a simple thing, metaphorically, when you connect the disease. So, for example, if I have only one son and I'm old, what does son mean to me? My son means the world to me. He is my protection, my support system, okay, my everything. So my own son is harming me or killing me. Similarly, what do we have in our body which protects us? White blood cells. These are the cells which give us immunity. They actually protect us from infections. So now my own white blood cell, which is supposed to protect me, is killing the mother red cell in the bone marrow. So the metaphor is my own son is supposed to protect me, is killing me. My own white blood cells is killing me. So what does red blood cell do in the body? Red blood cells contain hemoglobin. Hemoglobin attaches to oxygen, and oxygen gives us life. So my own son taking my life. So this metaphor actually really, shook me to the core. I said, wow. And then I said, okay, this is past life, but what triggered it in this life? So then she says, when she was about 13, 14-year-old, about 5, 6 years ago, her father was a busy man traveling all the time, and her uncle was bringing her up like a fatherly figure. And he gets married and he gets into
And she
trouble.
was perfectly healthy at this point of time.
Beg your pardon?
And she was perfectly healthy at this point of time.
Yeah. Until 14 years, she was perfectly fine. And the uncle just tells her, get out of the house, I don't need you anymore, go to your father. And she feels betrayed. She feels my own protection is harming me. And the son in that life is uncle in this life. So that triggers a process. Over the span of next 3.5 years, she developed this disease. And she came to me when she had the disease for almost 1.5 years. So this was actually, I would call a life-changing moment for me to look deeper. So I said, it's time to go deeper into this science, to find out there is a possibility of exploring the roots for even physical problems or well-established diseases in the physical body. So I used to think, sometimes, why did I waste so much of time, 12 years in studying medicine? But then now look back, it was so important for me, because had I not known the pathogenesis or the intricacies of how diseases occur, I wouldn't have linked these two things.
And Dr. Saab, how did you then proceed with that particular case?
Yeah.
And what was the
So,
result?
so basically, after I finish the session, and I'm still, operating out of doubt, not completely convinced. So I tell her, look, in 100 days, if you're not fine, you will not be fine, because 100 days is lifespan of RBC. By then, probably your mother itself should change and all those things. So fine, she goes away. After a few months, I call her. I said, how are you doing? She said, doctor, yeah, my blood transfusion has reduced. So now I take transfusion once in about 4 to 6 weeks. I was taking it once in 2 weeks. So I said, good. Why don't you come? Let's do something else. Something else is there to be worked upon. She said, doctor, you said it's not going to work. So that's how it, slipped away. And then that was another big lesson I learned. Ki, don't be judgmental or don't operate out of doubt. Just be open. Tell the patient, look, I don't know what is going to happen. Let's see how it opens up. Okay, let's be frank. Okay, I'm new to this. This is the first time I've done this. Let's see. Instead of putting doubt in your client's mind, just let it be open.
Be honest.
Be honest. And then after 2 years, she messaged me. She said she's doing absolutely fine, no medications, completely doing well. So now, from medical perspective, there is a possibility that these diseases can go into remission on their own. They can get, better spontaneously also. Now, did she get better spontaneously, or my session helped her? I don't know. But this one really opened my mind to a bigger field
Did you,
of research.
sorry, I'm cutting you. Was there any change in medication after this therapy, or was it,
So
or was it?
gradually, her medications were tapered. The
Okay.
medications were tapered as her transfusion requirement reduced. Her medications were tapered.
And what is the hypothesis here, Doctor? Why? How did she recover from this ailment? Was the awareness of that past life trauma that she went through, did that heal her? How did that healing take place, according to you?
Yeah. So as I just told you, the healing could have been spontaneous according to our medical science. In some cases, the healing can be spontaneous. They can recover. Some people recover. Okay. So if you consider for a moment that probably regression helped her, so how does it help? So basically, you try to find out the root cause. What went wrong? Why am I suffering? Why this disease? Why am I suffering like this? Why this terrible disease given to me at 19 years?
Yeah.
Number one. Number two, understanding the analogy. Okay, yeah, this is how it connects. Correct. I was absolutely fine till 14 years in this life. When this uncle did this to me, that's when slowly I started feeling lethargic and dull. And she carried a lot of emotions. There were a lot of crying happening, lot of venting out. So that's called catharsis. So first, understanding the root cause. Number two, understanding the wisdom behind it, letting go of the negative emotions, forming a new pathway, and telling your white blood cells, "Ki boss, it's over now. You don't have to harm. You are part of me." So that manifesting in the cells. is a possibility.
Wow. Dr. Saab, this you mentioned about this incident and the success that you had with this patient. I'm sure that must have given you a lot of confidence and faith in this entire technique. Um, was this followed by more such cases where your faith in this particular technique and therapy got further reinforced?
Absolutely. So it was add on time after time, session after session, patient after patient. So I couldn't deny the results I was seeing. It could not be just by chance.
For
And
the
there will,
benefit of, sorry, Dr. Saab, I'm cutting you, but for the benefit of all the people who are tuned into this video broadcast, sometimes it becomes a bit difficult to have faith in this because we are used to a particular kind of thinking. But जब आप ये एग्जांपल्स देते हो तो suddenly we start feeling that faith because you're saying it so genuinely and authentically, and it's kind of reaching to us. So can you maybe give me one or two such cases which were really dramatic and where you saw the impact of the therapy?
yeah. So see, when people come with doubts, skepticism, I respect it because I come from the same skepticism. If you had asked me 15 years ago, 10 years ago, not what this is, I would say, come on, cut the crap, man. Let's do the work. Come on, let's treat the patient. Yeah.
Yeah.
Stop all this mumbo jumbo. So everyone who comes with that mindset, I respect that mindset because probably I was the hardest nut to crack. It took me almost a year to convince myself. So to give you an example, so I have this guy who is about 23-year-old who basically is limping into my room because he's in pain. He has arthritis in multiple joints, and the disease is called ankylosing spondylitis. Okay, wherein you have arthritis, you have your back is badly hurting. It becomes like a bamboo over a period of time. So this was a diagnosis that was given to him almost 1 year ago, and he was put on medication. And he read about the disease, and he read that how over a period of time the spine becomes like a bamboo and you can't bend, you become debilitated. So he was completely broken. He said, "Look, doc, I have exactly 1 week or maximum 1 month. Okay, I'm planning to die. I'm trying to end this life, miserable life. I cannot because it's eating me from inside. Okay, I can't bear it. I don't want to get married. I don't want to be, a burden on anybody. I don't want to be handicapped. I cannot imagine myself being a handicap in future." He started crying, sobbing. I said, "Look, there is something, that I can offer. Okay, this is what I do. Are you willing to work?" He said, "Yes, of course. That is why I've come." So when we move back in time, so he goes back into a lifetime where he's enslaved. Okay, he's enslaved, and whatever earnings he makes out of the slavery goes to his parents who are sick and very old. So his job is to work in a in a in an area which is very hot, very sultry, and he has to carry heavy rocks for a construction place. So he's carrying it first. He goes on with full vigor. Ki, no, I will do it. I'm strong. I'm young. He's just 20-year-old. He said, I can manage. But then he's being ill-treated, not fed enough, not well treated, being whipped. So he carries this burden, big stones, and slowly every joint starts hurting. And once he actually sprains his leg and sprains his back, he's not able to lift the stones. But then he says, no, no excuses, come on. And with that back hurting, the sprain in the leg, he's still doing it. And every step feels like, an era for him. That's what he describes. It every step from 1 to 2 seconds feels like an era to me. And then suddenly he collapses under the weight of the stone. I said, then what's happening? So I don't know. So he actually died. Okay. And then Nothing. He feels terrible. I couldn't do anything for my family, my old parents, what's going to happen to them. Okay. I didn't do enough. And then when we connect this past life to the current life, so he finishes his graduation. He hails from a small village where people revere him. He was इसने graduation किया है and he will do something big. So he starts to work in a factory with heavy machinery, wherein again the environment is very bad, hot, humid, and the boss is like Hitler. He's very strict, and you're not doing this, you're not doing this, criticizing him. He says, I'm very tired, give me 1 hour break. 1 hour, you will not get 10 minutes break. So he's made to work, he feels like a slave, and that triggers this memory from the past life. And he's being humiliated in front of his other colleagues, and he feels suicidal, and then the disease sets in. And with the disease, he's still working, takes medicines, pushes himself, and that's when he comes to me. So this gentleman, after realizing all this that happened to him, making the connections, catharsis happens, the new wisdom comes in. He says, no, I wasted that life. This life, I'm not giving up. I'm going to face my boss. I'm going to work with positive energy. I'm not going to crib that he's treating me like a slave. No. So this mindset that changed, the wisdom that came in, the trauma that he left behind, he healed completely.
Wow. And
Yeah.
today he's a healthy man?
Absolutely healthy, married, happy, and he's like an ambassador. He refers so many patients to me saying, yes, go to him.
This is so incredible, sometimes it becomes a bit difficult to believe. It becomes difficult to believe that actually it is so simple. Whatever you are facing today is a combination of the situation that you're in, and also some of your past karma or your situations. One question that comes to my mind here, uh, which is, Dr. Saab, if I come from a philosophy which believes in karma, reincarnation, it's relatively easy to understand and embrace this therapy. Uh, but if I come from a philosophy that doesn't believe in reincarnation, will
Yeah.
it work for me? Because then that
Okay.
becomes like literal.
So I do get clients from different faiths and which don't believe in reincarnation. So what do I tell them? I tell them, look, you come to a doctor to find a solution for your problem. Okay. So I tell them, just with an open mind, approach it. Whatever your mind shows you, just see it like a story, your own story. Let it be imagination, doesn't matter. Ultimately, what is that you want out of this therapy? You want to sort your problem out. At the end of the day, after a few months, after session, if you feel good, your job is done. At that stage, if you want to criticize past life, please feel free to criticize. If you want to trust it, please feel free to trust it. Solution mil gaya, kaam ho gaya, the work is done. Okay. So this is what I tell them. So let me give an example here. So I had this a client who's a doctor and also from faith which doesn't believe in reincarnation, with chronic fatigue syndrome, with depression, with fibromyalgia. So the moment, she says, Natwar, look, I know you as a doctor, I trust you, but something goes wrong, I will not leave you. So I said, nothing to worry, just let's start. And within a few minutes, she slips into trance and goes into a lifetime where, she's a beggar, destitute, completely, starving, thirsty, cannot move, almost paralyzed. And the person is actually going through, okay, the situation. And her conscious mind tells, Natwar, what the hell are you doing to me? I can't move my hands and legs. Bring me out. I said, look, don't worry. Few more minutes. Just let this pass. And believe me, those few minutes passed, and it took 4 hours to finish the session. And she comes out completely, amazed what happened. So again, the same thing. It took almost 3-4 months. She got much better. She stopped the medications, and there it is. So at that point,
Wow.
do you still want to trust it? Please feel free to trust. If you don't want to trust it, that's your choice. Leave it to you.
Wow. Fantastic. We have a lot of viewers who are tuned in. I see Hukmi Chand has written, I'm grateful to Dr. Natwar Sharma for treating my life. I also see Ankit Sharma saying, the best doctor that I've come across for kids. So a lot of fans that you have around the world,
Thanks for
Dr.
good
Sir,
words.
and I'm sure you'll have more fans coming your way, because what you're saying is very, very unique. There is a certain logic to it, and most importantly, I feel there is a certain authenticity in the way you're saying this. So it's very, very interesting. Now that brings me to another point, Doxa, which is so what I can understand from what you're saying is that karma plays a big role in whatever happens to you. It's a play of your past karma and the actions that you're doing today. Um, does every disease that happens, every chronic disease that gets manifested, is that a result of karma, or when you say there are certain lifestyle diseases, uh, are they also linked with karma, uh, or it is a mix of both?
Okay, so here I would say, everything can't be just blamed on karma. For example, let's take an example. You are uh, in a place where there are frequent earthquakes, okay? And there's an earthquake, the building collapses, a young man loses a limb, he loses his leg, okay? Now he's completely, all his life, he's a handicap. Now, do you blame it on karma? Okay, you may call it mass karma, karma of the whole place, the whole
Yeah.
situation. Or somebody would say, no, 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 because his karma was like that, he chose to live in that country, he chose to live in that building, and he chose to be in that building at that time sleeping, and he got, okay. Or if you look at corona, the current example, okay. If you look at COVID, now the whole globe is going through this. Now, is it my karma that that we are going through this, or it's basically it's affecting everybody almost, and indirectly or directly people are suffering, okay. Indirectly people are living in fear. What is going to happen next? Is it going to come to me? Other, they are old people, they have chronic problems. So now where do you apply this? So many people going through depression today, so many people are not able to sleep, so many people are going through breakdown, so many people are becoming suicidal, okay. Corona is not producing all these symptoms. Corona is saying, I'm going to affect your lungs. If your lungs are good, fine. If your lungs are not good, that's it. So everything can't be blamed on karma. There are situations, see, for example, in the same house, there are 4 kids, okay, and 4 kids choose to respond different ways, okay. So that's how the environment also matters. How you're brought up, the conditioning matters. That's why we say, as parents, we must give our children the best childhood possible.
Absolutely. That's very interesting. A lot of comments coming. some of the experiences narrated by the doc seems to be mine, says Madhurika Agarwal. Hem Upadhyay says, I too am really grateful to Dr. Natwar. He's changed my life. Gunjan Sharma says, amazing doctor. He brought my mother off heavy medications that she had been taking for 20 years. Huge respect for him. A lot of love and respect pouring in, Doctor.
Thank
This
you
is
all.
amazing. To all the people who are tuned into this broadcast, if you have any questions for Doc Saab, I'll be taking those questions. If there are any experiences that you would like to share, little detail, I would be happy to share that with everyone. So, Doc Saab, now what you say is that karma plays a big role, and so does the situation of your life. And there are a lot of things which are controllable, and there are a lot of things which are hidden, like which could be revealed in past life regression therapy. Now, does my current life experiences, do they also have an impact on my health? So one is my past life, but does the current life experience that I'm going through, do they have an impact on my health? And does this therapy also help in that?
So thanks for bringing this point out, Sharad. So if I take say 100 people and regress them, almost 20 to 30%, they don't need a past life. It's just the current life where we regress to either the womb memory or when you are an infant or a child or in your youth. So trauma that was created in this lifetime actually turns into problems: physical, emotional, mental, psychological. Okay. So if you look at a wound, which wounds hurt more? The fresh wound or the old wound? Yeah. So if I have a cut today,
Right.
it will pain the
Right.
most. Yeah. So the
Yeah.
current life memories are very important. They actually form a flesh, everything on a skeleton of past life. So the past life is just a framework, a subtle framework, okay, around which I build the whole thing. So when you have a past life, there is usually and most probably a trigger in the current life which was similar to the past life experience, and then it starts, blooming. So it's like a seed exists inside me, and when the seed found an appropriate environment of emotional trauma, physical trauma, whatever happened, it sprouts and then slowly starts becoming bigger and bigger and bigger, and then starts bearing fruits. But having said that, not everyone needs a past life. There are some people who just need current life regression and they do well.
I get that. And how difficult is this entire therapy? How does one go into the past life? How much time does it take? Is it possible to do it remotely, or do we need to be in your physical presence to do that?
Yeah. So basically, see, the first thing is to understand whether a person needs regression. So that way I'm blessed because as a doctor, I know the intricacies of a problem. I take history, I find out. So before I commit to them, okay, I'm going to do the regression on you, I have a brief interview with them for 5 minutes to understand what is your problem. Can regression address this or can not address this? And once I find, yes, this can be addressed regression, then I probe into the problem deeper. That is where the intake, the history session is very important, wherein I really go to the depths. It may take half an hour or an hour or so, but there I understand the whole thing. Okay, this is what is the problem, the core problem. And then after you close the eyes, using the problem as a tool to take into the trance, that's when we start working. Okay. How long does it take? Each session usually takes about 2 to 3 hours. And suppose I have one issue, suppose I'm claustrophobic, how long does it take to resolve that? Usually 1 to 2 sessions. Okay. And the third question you asked was, is it possible to do it remotely? Yes. So I started this experiment in 2016 in Denmark. The client said, "Sorry, I cannot come," because until then I was doing it in one-to-one physical presence, because sometimes you need to do physical body work, touch certain parts of the body, or evoke a particular emotion, let it out, and most importantly, it gives a comfort to the client ki bhaiya, you're taking me into a past life, you are somewhere sitting there, what if connection goes, what if I'm lost? That fear usually exists. But by 2016, the internet improved. So I said, look, these are the troubles we can face during the session. Are you willing to take that? She said, okay, no problem. So session went very well. And since then, people who were limited by their ability to travel, I would do remote sessions, long distance sessions on Skype, or now we have Zoom. And now, in the last 1.5 years, mostly they are distant sessions. But if I find a client that needs my physical presence or one-on-one session, I tell them, if you can wait for me, otherwise I refer them to somebody else.
Wow, fantastic. Uh, I'll just read out some of the comments that are coming. A very eye-opening interview by Dr. Natwar Sharma. Super questions, Sharat Bhai too. Thank you, thank you. Just bought several copies of his new book for gifting to friends and families all over the world. Everyone should do the same. Yeah, I think the science, if the science exists, and increasingly, I think, I am believing this, then it needs to go to the world. And I'm glad that we are having this conversation on this platform and the world is tuning in. So I think the start, wo shuruaat ho chuki hai. The beginning has is already started, and it's only a matter of time. I think before we keep asking the right questions and approach it, maybe even with skepticism. But if we keep asking the right questions, I think we will definitely make a breakthrough. Um, and also, I have a question from Monica Shah. Doctors are most of the patients who are poor or had bad past only face problems of depression in this life. Did you come across anyone who had a luxurious life and still faces such an issue? So what she means to say is the examples that you quoted, in both the cases, the subjects uh, had didn't have a luxurious life. They had a tough life. So do luxurious lives also lead to certain karmic
Yeah.
manifestations that are not positive?
So I had a client who was basically depressed, okay, not happy in life, suicidal, very rich, filthy rich, and going through a similar pattern. And when we explore, she belonged to a royal family in Scotland, and her life was miserable. Living in that society, everything felt artificial, everything was hypocritical. The way you smile, the way you wear clothes, the way you put your spoon, the way you turn, the way you stand up, the way you sit, everything is being watched, everything is being judged. There is no freedom. And this client describes that whole lifetime as the worst prison anybody can have. Wherein, even to breathe, you must think, can I breathe deeply? No. Can I sneeze now? No, I need to control as much as possible. Uh, can I look through the window when children are playing out there, poor children playing out there? No, I'm forbidden to look at poor children playing out there. So, see, believe me, the best lifetimes, people actually, feel happy about is not being rich and powerful. A very simple life connected to nature, you know, very nice, amazing lives.
Wow.
Yeah.
I have here Pratibhan Arumugham, uh, in and she's written that he cured my daughter's Kawasaki disease at Savita Hospital very special doctor to us. Do you
Thank
remember
you.
this
Thank you.
patient? Do you remember this patient,
Yeah,
doctor?
yeah. I didn't cure him. The medicines cured him, so it's fine. I just diagnosed the problem in time, and we picked it up early and we treated it early. So child is fine now. Thank you, Armand.
Fantastic. So, Doctor, for people who are leading a normal life right now, they're disease free, and relatively anxiety free. What are the learnings from the past life therapy which they can put to use in their normal life? What would be your advice to them? How should they lead their life so that they move towards more happiness, which is the goal of every life?
See, one thing I have learned is as long as we exist on earth, we are bound by the laws of duality. Okay. There can never be a completely happy life. There can never be a completely sad life. Life is a mixture of both. Now, suppose I'm always happy. I will not appreciate happiness. Only when I have tasted sadness, I can appreciate happiness. Okay. So when you look at a lifespan of a person, on a daily basis, we have ups and downs. So my advice them to is to take it in the stride. If you find it's agitating you, understand why it's agitating you. Sit for a moment, brood over it, and try to let go. Having said that, it's not easy, and that's why what has actually grounded me, in my life as a doctor, as a therapist, is doing meditation. So I have been practicing heartfulness for the last 25 years, and it keeps me sane, grounded, not just getting carried away by things. So I usually call it as a stress pill. Today's world, you cannot avoid stress. Believe me, unless you are living in a jungle or somewhere. No, stress is has become the norm of today's life. So when you can't avoid it, how to deal it on a regular basis? Yes, this is what you can do. So meditation is something where actually it takes you deeper inside you, your own self, and during those times you get lot of insights about yourself that actually help in sorting your problem. And we also have a unique way in heartfulness wherein there is cleansing in the evening, so to just cleanse yourself whatever has happened throughout the day. So this amazing system has really kept me grounded, and that's why my gratitude to all my spiritual gurus.
Wow, fantastic. Um, I wanted to ask you some pointed questions on some of the diseases which are very common nowadays. Diabetes. What does your findings and your experience tell you? What kind of karma leads to diabetes? Is there some kind of a correlation there?
Okay, so see, diabetes is two types, type 1 and type 2. So are you asking about the regular diabetes which happens around 40, 50?
That's right. Yeah,
Yeah, so this diabetes is usually a lifestyle disorder wherein we basically live a kind of lifestyle which is not healthy. See, as human beings, we are designed to move. Okay, the movement is necessary to keep us healthy and lively. But in today's world, the movement is restricted more and more. You step out, you have a lift. You get into a car, transport yourself. Okay? Then anything you need, just click a phone, it comes. You don't have to put effort. So the movement has reduced. Okay? That is number one. Number two, the kind of foods we are eating is unhealthy. Number three, there are usually roots to this. So, for example, I know it's unhealthy, but why am I still eating it? I know exercise is important, but why am I not exercising? So there lies the roots to it.
Mm.
So am I lazy? Am I procrastinating? I'm lazy because I'm depressed, or I've given up in life, or I don't want to put effort. How much ever effort I put, it goes waste. So there are patterns lying beneath it, which usually forms in the childhood. Okay. At the same time, if you see, genetics say that okay, diabetes can run in families. So if my father has diabetes, there's a chance that I'll develop diabetes. Yes, because my physical framework is basically coming from mother and father 50-50. Okay, so definitely I'll be predisposed to same illness if I start behaving the same way as my parents did. So if my mother has learned to suppress her anger, not let it out, I will become hypertensive. If my mother has taught me not to sort of confront people or let go of emotions, just be quiet at work, anywhere, it builds up stress in my body. And stress, we know, it develops, results in diabetes. So, how I am conditioned, the environment in which I grow in, also matters a lot. That is the epigenetics part of it. So, there is genetics, there is epigenetics. But if the epigenetics is strong, the genetics can lie down. So that can overrule your genes. So if you start living healthy, if you start taking charge of your life, saying, boss, enough is enough. I have wasted enough of my time. I'm going to be healthy from now on. I'm going to work out. I'm going to eat healthy. There it is. It is reversible. Diabetes is a reversible disease.
Wow, that is pretty
The
strong.
type 2, the type 2 one, not the
Type
type
2.
1. Type 1, we lose the insulin completely. The pancreas loses the ability to manufacture insulin.
Absolutely. And what about cancer? What is the karmic connection there?
So, cancer, see, I have dealt with quite a few cases of cancer who all came to me in the last stages, stage 3 or stage 4. And I don't have a complete breakthrough where I can say, okay, that person got completely cured. There are people who got treated who I tell them, please continue allopathy treatment, don't stop it. Okay. At the same time, understand the root cause of your problem. For example, one person is constantly feeling, why the hell me? I'm such a
Mm.
good person, not hurt even an ant in my life. Mujhe cancer, why cancer has come to me? So that why question answered from your past life tells you, oh, this is why it's happening. Because now I can look at a bigger picture. This is what I created for myself. Fine. That is number one. Number two, once I understand why, then I stop brooding over it. I accept it. चलो ठीक है, हो गया सो हो गया. Now I need to work on this. So how best can I do physically, emotionally, mentally, psychologically to get rid of this? So there are people who are given just a few months time. They said you have few months to live. And when they come to me, they understand what went wrong, why they had cancer. They live much longer in a much peaceful way, happier way. So this little happiness was a substitute to the cure, which is completely overrated because you cannot replace cure with. But this little happiness that they had in the last few months of their life was important. And they wrote wonderful letters to me, saying, so that was very touching.
Yes.
But my one message would be to all my doctors communities not to give a prognosis saying, boss, you only have 2 months to live. No. See, these studies are done on a large group of patients, and then you calculate numbers saying the possibility of you living is 2 months is 60%, then 70%, 100%, or whatever it is. So tell people there are people who live so long, there are people who take treatment and they have recovered. That is the kind of prognosis you need to give because otherwise you're setting a time bomb. Button daba diya. The
Mm.
moment the person walks out, doctor said 3 months. Yes, my time, I'm going to die in 3 months. I wake up, I sleep with the same thought. Not only me, my neighbors, my friends, my family looks at me like this. And that pity, that thing, I mean, it kills you. Ki boss, look at him. He's looking at me with those eyes because I'm going to die. The same fellow used to fight with me, used to, sort of quarrel with me, and now he's become extremely nice because I'm dying. So everything around you start reminding you of death, which is not a good thing. And that's why, in older times, not that we didn't have cancer, we did have cancer, but people knew they have some problem, but it was not prognosticated and set, timer was set in them. No. They still live, and in India, still, there are some people who choose to hide the diagnosis from the parents saying, Doctor, please don't tell my father. Fair enough, respect that, but let him live that last few months or years of his life happily. ठीक है बीमारी है ट्रीटमेंट चल रहा है I mean there's a problem we're treating it fine because this conditioning negative conditioning has a very strong influence.
Sure. Acha, Dr. Saab, I just got a message from one of my friends who's tuned in. He just sent it to me on WhatsApp. His name is Parikshit. And Parikshit says, Ki, does this mean that if I have an fear for confrontation, if I get agitated when a thought of a confrontation comes, and I know Parikshit, he has that, does that mean that it is linked to my past life? Because the way I've been brought up, Parikshit writes, I've always, I've had an family which encourages me to express and to be very open, and yet I could never confront people. I always have this, unexplainable fear whenever there would be an confrontational situation. Could that be linked to my past life?
So Parikshit, there are multiple questions in the same question. So let me start with the first one. So I never tell people you have a past life to this. No, I don't know. Because see, to be frank, I don't know what happened in your past. It may be childhood, it may be in your mother's womb, or it may be past life. I just tell my clients, look, just go with an open mind. Whatever is there, the mind knows it. That's the beauty of the mind. It will bring it out. Okay. So to answer the first part of it, whether past life exists or not, I really don't know. I can't answer. Okay. It may be there, it may not be there. But definitely, if you look at this fear of confrontation, let me come to this. So this is how I dig up and peel. So if I confront somebody, what's going to happen? If I confront, oh, I may hurt people. So what if I hurt people? When I hurt them, I feel bad. I cannot hurt people. Why can't you hurt people? Because they will judge me or they will misjudge me. If they misjudge me, how will I feel? Or they may reject me. If they reject me, what's going to happen? Oh, they reject me, I'll be abandoned or I'll be lonely. And loneliness is killing. No. So look from the tip of iceberg is fear of confrontation. But beneath that lies a deeper fear, fear of loneliness or being abandoned. I hope I answered your question, Parikshit.
Yeah, I think.
Otherwise, you can take my number from Sharat. It's just an example,
Yeah, but I think it's pretty insightful that the deeper emotion, the driver emotion,
Yeah.
is something that you arrive upon when you do the past life regression, and you understand that what is the core emotion, the fundamental
Yeah.
emotion, which is getting manifested in forms of different emotions. That's really fantastic. We have another 5 minutes before we sign out, so um, if you have any questions, please fire them away. Um, Dr. Saab, another thing that today that we face in our lives is that uh, there is always this competitive pressure. You always feel that you need to catch up, uh, and there is so much comparison happening in your head, and that leads to a lot of stress. Um, it also gives you a sense of incompleteness. You feel that you are inadequate. Uh, These kind of pressures that one faces on a day-to-day basis, and you always feel that you need some kind of a support. Sometimes you hit the bottle, sometimes you seek refuge in friends, sometimes you seek refuge in hobbies. You try to divert your mind in way, and put it in various things. uh, would you advise someone who doesn't have any health issues as such, but is facing the regular stress that one always goes through, to take up this therapy? Will it be helpful, or is it something which one should only take up once one is facing a certain condition?
Okay. So here again, there are multiple questions, almost five of them in the same question. So number one, so why am I going to alcohol? Why am I going to drugs? Or why am I smoking? So basically, these are the things to fill up a void. So I'm having a void. I need to fill it up with something. So here, that's where you need to find out the void in that person that the person is trying to fill up. It can be insecurity, it can be lack of self confidence, it can be lack of self esteem, it can be, being bullied as a child. Okay. Now, the second part is you're asking stress is there, competition is there. See, competition is healthy and unhealthy depending upon how you take it. This is a constant struggle. Every constant struggle every parent faces. Oh, Papa, look, today I scored only 47 out of 50. That guy scored 49. What do I do? Crying. So now, why did I get less marks? That is what you need to look at. Not compare yourself with the 49 the person who got 49, but rather where did I lose these 3 marks? So marks are not important. It is my deficiency which I need to look at, identify it, and rectify it. So in a competition, if I'm feeling inferior, I just need to look at myself. Where am I lacking? Am I not putting efforts? Am I not sincere? Am I not hardworking? Am I not dedicated? Look at these facts. Okay. And if these things don't answer a question, then third question is, do I need to compete first of all? I must understand that this person belongs to a different ilk. He has a strength. He is very smart. His brain works at an IQ of 160. Mine works at 120. Have humility to accept that fact. Okay, this is his strength. What is my strength? Where can I manifest my strength? That's why you need to try. Don't keep going the same loop and getting that, because there it will keep killing your confidence day by day, day by day, day by day. Third thing, why do I need to compete? Where does this come from? Is it because throughout my childhood, I was a thin kid, I was, not good looking, and I was bullied, and I always wanted to prove myself, compete with the guys. So is that coming from my childhood which says, ki, no, I need to prove myself, I need to prove myself? So there are multiple facets to this. And believe me, every individual has a unique story. The patterns may be similar, but सबकी एक कथा होती है, मतलब everybody has a story. So we need to dig up and find out where it lies.
Fantastic.
So
Another question.
sometimes just simple advice helps, sometimes advice doesn't help. Then you do regression therapy, and sometimes simple thing like meditation helps.
Great. I think we are almost we've reached the end of the session. This absolutely engaging session. One last question, which I can see on the screen, is that uh, is autoimmune disease also related to past life?
So as I said, autoimmune disease is where my own immune system is attacking me. Okay. In my experience, yes, most of them have a past life. Maybe a few didn't have a past life, but most of them do have a past life.
Some other diseases which you felt have a past life connection, a very strong past life connection?
Beg your pardon? What was the
Any
question?
other diseases that you felt have a very strong past life connection?
Hmm. Now, when you ask me this question, okay, so yeah, cancer, I found most of my clients, I mean, if I would say not erring, most of them had a past life.
Hmm. I think that is something which could be of immense importance for us and for our loved ones. So anyone who is watching this video, if you know someone who's struggling with cancer, I think you should share this link. You never know; it could be helpful for that person. Um,
But there are a few examples where I
yeah,
would like to tell you that, when cancers come out of radiation, so
yeah,
there was a blast, radiation happened. Cancers that come out of occupational exposure to
mm,
asbestos. Okay, cancers that come out of side effects of drugs we use. You treat one cancer with anti-cancer drug, it produces another cancer. Now, when
yes,
you look at this, there is no past life to it. It happened in the current life. You gave me poison, I died, or you cut my hand, I'm bleeding. Straightforward.
I get
But
that.
again, why did I choose a life to work as a worker in an asbestos factory? Or why did I choose to have or to be in a place where there was radiation blast or exposure? Now, that question, so egg came first, chicken came first, you can keep going on.
Fantastic. So all you people who are tuned into this broadcast again, I would recommend this amazing book by Dr. Saab, The Metaphors of Memory, Healing Through Past and Current Life Regression by Dr. Natwar Sharma, who was in conversation with us and who enlightened us about a very different approach to medicine, a different therapy which actually could cure a lot of chronic diseases that medicines are not able to cure. So, Doc Saab, you spoke so well. Um,
Thank you,
the
sir.
examples that you gave us were filled with logic, and the most important thing, there was an authenticity in the way you spoke that gives us a lot of hope and faith in this therapy. And I think just like you, a lot of people will embark upon this journey, which will probably start with skepticism, but hopefully it will end with wisdom, hope, and happiness. With that note, I'm concluding this absolutely fantastic session. Thank you so much for your time and wisdom.
Thank you, Sharat, for being a wonderful host. And thank you, Kalinga organizers, for giving me this opportunity.
Thank you.
Thank you, one and all, for joining this program. Thank you.
Thank you.